We now want to turn to Corey Johnson, who is on the phone with us, the out gay, out HIV positive as well, Speaker of the New York City Council. Welcome, Corey.
Thanks, Ann. Thanks, Andy. I hope you guys are staying safe during these scary times.
We're doing our best, and you, of course, are a longtime member of the Gay USA family as an occasional co-host of this show, Corey. We're very grateful to have you join us today.
And I know before the show you were saying you two shouldn't be out. I do feel safer doing this. We don't take the subway. We walk here on basically empty streets, and the studio is almost entirely empty because the public is barred from here.
But we may stay home and do it by Skype next week.
Anyway.
All right, so Corey, first I want to know how you are. Tell us how you are someone living with HIV, but you're young and strong and an ex-football player. So how is your health these days as you spend about 90 hours a day dealing with this crisis?
I'm doing okay. You know, I haven't gotten sick, which I'm grateful for, given we're seeing so many people struggle, not just folks that are dying, but also folks that are in critical care and have loved ones who are getting sick. I'm very lucky. I've been staying at my boyfriend's apartment in Brooklyn with his dog and my cat, and we've been practicing social distancing. I maybe go out once a day and go for a walk for about a half hour just to get some air, but we haven't had contact with anyone. And you know, being someone who's living with HIV, I think it's important to talk about the fact that we want folks to stay safe. If you have a well-controlled viral load, if you're undetectable, you aren't in the standalone category that has been laid out by public health professionals of being at a higher risk. So it's really important that folks stay on their HIV drug regimen to keep their viral load low, and I, of course, have been doing that.
And those who should be tested for HIV should be tested to get on treatment so that they can control their viral load and be safer.
That's right. Though right now it's very difficult with the healthcare system in New York City that is getting overrun by COVID-19 cases. I know this is a national show, so if you are in a place across the country where it is still safe to go out and go to a healthcare setting to check on your status, do that, but check with your public health professionals wherever you live on what their guidance is on staying home and on social distancing.
So we are hearing predictions of a real horror show to come, of a tsunami of coronavirus cases heading for New York. What is your personal assessment of that?
Well, we're already seeing it. We're already seeing hospitals that are getting overrun here in New York City. The hardest hit hospital right now, my understanding, is Elmhurst Hospital, which is one of our public hospitals in Western Queens. But I think that is really just a sign of what's to come for almost all of our hospitals here in the largest city in the United States of America. And one of the things that I'm most worried about is we have basically three things going on at once. The first is we need to halt transmission, and that is why you've been seeing this pause order from the governor telling people to stay home and socially distance. Number two, every single day we're trying to increase hospital capacity to have more beds, more ICU beds. We need more personal protective equipment for healthcare workers and nurses and doctors and folks that are in the hospital setting. We need more ventilators. So those two things are going on at once. And then the third thing, which is affecting everyone, is the folks that are now much more economically ruined because of the pause order that's been put in place. You've seen a lot of talk out of Washington about big corporations. We need to make sure that any bill that passes is going to help gig economy workers and freelancers and domestic workers and small business owners and folks that don't typically qualify for unemployment insurance benefits. You have those three things: halt transmission, increase hospital capacity and personal protective equipment stockpiles, and delivering cash assistance and money to folks that are in a much more economically precarious situation overnight.
And of course, the healthcare workers, are on the front lines. I mean, it's absolutely courageous. It's unbelievable, and it's outrageous that they don't have what they need. What about the grocery store workers? Who are checking out our food? That's the one, or the pharmacy workers. These are one of the few places that we can go. But how about protecting those people as well? Is there a plan?
I mean, that is what is so shameful about the situation that we're in, that you have not seen the president fully invoke the Defense Production Act to ramp up the supplies necessary in personal protective equipment. And because we already have a shortage here in New York City, we have been prioritizing that equipment for people that are in a hospital setting where they know they're dealing with COVID-19 patients, though we should have enough equipment to protect everyone. And I think the one point to make is we really want to, of course, as you just did, Andy, give our thanks to these healthcare workers that are on the front lines that are so courageous doing this work every single day away from their families and loved ones. But when you look at these essential workers, the essential workers are now the pharmacists and the grocery store workers and the folks that are working in schools and the janitors and all of these people that don't get their due day in and day out are now really saving lives on a daily basis. We want to give them gratitude. We want to give them thanks. Our firefighters, our police officers, all of them. But at the same time, we also want to make sure that we're ramping up production enough to cover everyone who is on the front lines and needs a mask and needs gloves and needs the equipment to stay safe.
I understand that 10% of the police force now has been diagnosed with the virus.
I don't know if that's the exact number, but we know it is a significant number. And again, it shows why it is so important to stay home, to halt transmission, and to get these folks the gear and the equipment that they need to protect themselves.
Now, what about homeless LGBT youth? Homeless people in general, of course. All of them. Shelters are closing. They wouldn't be great places to be in as people packed into rooms anyway. But what about the homeless and specifically homeless LGBT youth?
I saw today that it was announced by the Department of Homeless Services in New York City that the first homeless person has died from coronavirus. But I have been very concerned about homeless shelters. I've been concerned about Rikers Island, where we're seeing a major outbreak of incarcerated folks, and we need to release more people from Rikers Island. There's a lot of folks that are there that are older, that have compromised immune systems, that are there on technical parole violations or other parole violations, and we need to get people off the island. As it relates to LGBT people and homeless LGBT people, it's scary because in so many of these shelters that are set up outside of a pandemic situation, they don't allow for the social distancing and isolation that you need. You have people that are sleeping in very close quarters, eating in very close quarters, showering in very close quarters. And so the Department of Homeless Services have been trying to set up shelters that are just for people that may have been exposed or may have mild symptoms to keep them away from everyone else. They've been identifying places to do that. If you are someone that is watching and you have concerns, you should contact 311 here in New York City to get information about how to best protect yourself if you are currently homeless New Yorker.
Now, Corey, you talk to people, government officials all over the country. Is there anybody in the White House that can get Trump off the nonsense that he's talking about now, so that we can get a more unified national message of distancing, lest we be doomed?
And urgent production of
yes.
more ventilators?
I mean, I know that the governor and the mayor have been speaking to the president and the vice president on a near daily basis, but his press conferences are dangerous in
yes.
so many ways, and I am glad that some of the media have said they're not going to air them anymore because he is giving out misinformation and potentially endangering more people. Not potentially, he is endangering more people. It's really important in a moment of crisis to level with people, to set expectations accordingly, to talk about opening things up around Easter is the height of irresponsibility. We need people to stay home. And what folks are seeing in New York is really the canary in the coal mine, because we know that this virus sees no borders. And so we may be getting hitting hardest the first, but what you're seeing in New York City could be coming to any place around the country, which means that these other places need to take the measures earlier than we took the measures. They need to start building up their hospital capacity, and they need to be planning for a worst-case scenario. And so if you have the president who is giving out misinformation, who is downplaying things on a daily basis, it is frightening. I do think that they've given us a small amount. We saw yesterday they announced 4,000 ventilators for New York State, 2,000 going to New York City, 2,000 going to the rest of the state. The need we have right now is really 40,000 ventilators for the state of New York, and we only have a fraction of that. The same thing as it relates to N95 masks, surgical masks, face shields, gowns, gloves. So we need to ramp up production. There was a good call yesterday, I believe, with the CEO of a company called 3M, which is based out of Minneapolis, Minnesota, and they have been the manufacturers of a lot of this personal protective equipment, and they supposedly are going to be sending a huge cachet of this PPE to New York City and to New York State. But we shouldn't be doing this in an ad hoc way. The federal government and the White House should be requiring manufacturers to start manufacturing these products. They should have done it weeks ago, and they need to do it today to help the hardest hit places. Right now, New York City has 5% of the cases around the globe, and I believe we have a huge percentage of what's happening in the country. We are now the epicenter of what's happening in the United States of America, and we can't be doing this in an ad hoc way. We need seamless coordination and support from the federal government.
So contact your senators and your Congress members and make them do the right thing.
Corey, one more thing from me. I have been, frankly, horrified at the ongoing partying of particularly the gay male community. I would like to think that has stopped now, but on the off chance that it hasn't everywhere, can you, as someone who I think is a very powerful role model, talk just for a second about things like the winter party, the bars that were packed until very recently, and give a direct message to gay men?
The most important thing that anyone can do right now, unless you are a healthcare worker or someone who's working at a pharmacy or a grocery store or is deemed an essential worker, the most important thing you can do is to stay home. If you stay home, you will help us halt transmission, which will ease off the hospital system a little bit. We know that the peak hasn't even come yet, and so we need to keep halting transmission to make it easier in the days and weeks ahead. I have the same concerns. You have seen, particularly amongst a lot of young people, them not understanding the gravity and the seriousness of this. And so even though in New York, I think we're seeing pretty broad compliance right now, anywhere across the country, even if you haven't been put under direct order by your governor, by your mayor, and you have the president saying irresponsible things, you yourself can make a difference in this epidemic, in this pandemic. You can stay home, you can socially distance, you can do those things. You should not be going to bars or restaurants or parties or barbecues or gyms. You should be really taking this seriously, because you can save a life or lives right now.
Well, thank you very much, Corey, for all you're doing. Keep us posted, and we'll keep our viewers posted, and we thank you for being with us.
Thank you.
Stay safe, Andy and Ann. I love you guys.
Love
Please
you
be
too.
safe.
Love you too, and you stay safe.
We want to get you back here at this table someday.
Yes.
Thanks a lot.
Stay